Hello, everyone. Good afternoon, and thank you so much for joining us. I am host Danielle Banda of CBS 4, and today we are talking about coronavirus. It's an illness caused by a virus, of course, that can spread from person to person and indeed has across the globe. Joining me for this Rio Grande Valley COVID-19 Facebook Live forum is a representative from the American Association of Retired Persons, AARP-RGV, and local community leaders, Cameron County Judge Eddie Trevino, as well as Dr. James Castillo of Cameron County Health Authority. So how exactly does COVID-19 affect you right here in the Rio Grande Valley? Well, please welcome Mr. Donald Ham. And Donald, we appreciate you being here so much for sharing information on how we right here in the Rio Grande Valley can indeed stay safe, stay healthy. So we have online viewers tuning in right now. Perhaps you could officially introduce yourself as well as elaborate on the discussion today's Facebook Live forum will regard.
Hi, my name is Donald Ham. I am a local nurse. I've been here in the Rio Grande Valley for over 31 years. I am also a lead volunteer with AARP RGV, and I welcome you to this important discussion about coronavirus. Today, we will discuss how you can stay informed and stay healthy with Cameron County Judge Eddie Trevino and Dr. James Castillo, Cameron County Health Authority. And we will be taking questions as well. AARP is a nonprofit, nonpartisan member organization. AARP has been working to promote the health and the well-being of older Americans for more than 60 years. In fact, of this crisis, AARP is providing information and resources to help older Americans and those caring for them to protect themselves from the virus and to prevent the spread of the virus to others. According to the CDC, or the Centers for Disease and Control and Prevention, older Americans, older adults, and people with underlying health conditions like heart disease, lung disease, and diabetes are about twice as likely to develop serious outcomes than younger, healthier people. This is your opportunity to learn and to ask questions and get answers from County Judge Eddie Trevino and Dr. James Castillo. If you would like to ask any questions about coronavirus, please type your answers in the comments field at the bottom or on your screen, and we will be collecting them throughout this Facebook Live presentation and answer them accordingly.
Yeah, absolutely. And I believe we'd like to introduce our experts right now. We are fortunate enough to have with us, as Donald mentioned, Cameron County Judge Eddie Trevino, as well as Dr. James Castillo of Cameron County Health Authority, our region's leading expert on the subject. So once we hear from our experts, we will spend the rest of our time, as mentioned, answering your questions. So thank you so much, Dr. Castillo, for taking the time out of your very hectic schedule. And thank you, of course, for all that you're doing for Cameron County residents. We really appreciate it. So Dr. Castillo, what is the latest news regarding the number of coronavirus cases specifically in Cameron County?
Cameron County was hit really hard by this virus in comparison to other places in Texas, and even in comparison to other places in the world in terms of the number of infections based on a county our size. This virus started in Wuhan, China, and then started spreading across the world and went into Europe. And we saw what it did in Italy and Spain and in the United Kingdom. And when it first came to the US, we started seeing it in the Washington, Seattle area, in California, and New York. And I remember back then people, saying, well, it's never going to come here to the Valley. And we're not a big city and we're different. And we don't have international airports and we don't have travel from those places. And for the beginning part of this, that was true. But then when it started coming into the Valley in March, it followed the similar pattern that we saw when it came to Washington. It started in our nursing homes, This virus definitely affects those who are vulnerable, those who are older, those who are living with chronic medical problems, and those who are living well with chronic medical problems. So just because you have chronic illnesses doesn't mean that a person was particularly vulnerable, was enjoying a great quality of life, but then this virus definitely poses a special threat to them. So in our first warning about this virus was in our nursing facilities. And then from there, it got under control with the shelter-in-place order that here in Cameron County was put into place very quickly. But once a lot of those restrictions started loosening up, we got to see the other half of what this virus can do. And what it was able to do was take advantage of our close family communities, our close relationships with each other, and our social culture, and spread through families, from young people into their older relatives. And we don't have subways, we don't have skyscrapers, but we have close family units. And we have many, many people living with what turned out to be the other risk factors for bad outcomes of coronavirus disease, which was obesity, diabetes, heart disease, cancer. And these are people who are living well with those issues, but when they get this virus, it makes them so sick that they get hospitalized. And unfortunately, it overwhelmed our hospitals. And our hospitals, from having almost no patients, went to being overwhelmed, went to having to call in, medical staff from all over the state, to having the Department of Defense here with doctors and nurses and respiratory therapists to just expand access inside of our hospitals, build pop-up intensive care units. And, in July and August, we were seeing death rates on par with what happened in New York. And then from there, I think everybody now in the Valley, in Cameron County for sure, we've confirmed that 5% of the population of Cameron County has officially been infected with COVID-19 by PCR test. There's probably a whole lot more than that. The CDC thinks that in some places it's 10 times more than whatever you've proven. And that definitely shows what happened in our population and our death rate. Our hospitals are now, still we have over 60 patients to this day in the intensive care units across Cameron County with COVID-19. We have still many, many people hospitalized. We still have people getting hospitalized, but in general, we're starting to see the trend that we're seeing across Texas, which is a decline in cases. The number of new daily cases is dropping. The hospital census is dropping. I hope it's because everybody's listening to what the judge and what all our leadership has been saying about wearing masks and physical distancing and washing your hands and avoiding crowds and watching out for those family gatherings. So all that advice we've been giving, I think either people are following it or the infection has just hit us so hard. I think it's probably a combination of those things. But it's definitely, we're seeing the fruits of that, but we can't squander it either. And we have to be real careful as we move forward and seeing the number of cases drop, not to become complacent.
Absolutely. And just so we're clear, what exactly are the coronavirus symptoms that people should be looking out for today? I want to elaborate a little bit on that.
Sure. So when this virus was new, and we're calling it the novel coronavirus, now we feel like it's been around a long time. We were focusing a lot on fever, on cough, on shortness of breath. It sounds a lot like the flu, right? Then we started knowing a little bit more about it and some real particular things about it. Very different than flu. It's really common to get shortness of breath. It's also common for people to maybe lose their sense of smell and taste. That's a very unusual symptom. That you usually don't see that in other conditions. And then we started finding out that sometimes there's nausea, vomiting, diarrhea involved. Nasal symptoms at the beginning, we were dismissing those. No, this definitely can give you stuffy, congested nose or runny nose. Not everybody gets fever. So it's this constellation of symptoms that range from muscle aches to fever, cough, shortness of breath. The real particular one, though, is if people suddenly lose their sense of smell or their taste goes out.
Perfect. Donald, would you like to add?
No, I just want to thank Dr. Castillo for that overview, and I'm so glad that we're all able to hear your guidance, sir. Hi, my name is Donald Ham again. If you're joining us for the first time, I'm a lead volunteer with AARP, Brownsville, or Rio Grande Valley, and you're watching a Facebook Live meeting where we have joined together Cameron County Judge Eddie Trevino and Cameron County Health Authority, Dr. James Castillo. Looks like a lot of questions are coming in and in reference to the coronavirus. So Dr. Castillo, can you address some of those concerns for our viewers?
Yeah, absolutely. Thank you so much, Donald. It is indeed now time to take viewer questions. We have a lot of folks in queue right now waiting to ask Dr. Castillo a question. So, Dr. Castillo, regarding a possible vaccine for COVID-19, is it likely that there will be tests done prior to distribution to the public in order to test effectiveness? Would there be any side effects? What can you tell us?
There won't be a vaccine available till it's tested. And it has to be proven safe and effective. The good news on the vaccine front is that a lot of vaccines are in something called phase 3 trials, which means effectiveness. They've gone through the safety trials and were found to be safe. And now they're in the effectiveness mode. In other words, does it protect you? So if you get this vaccine, does it protect you? There's a few different companies coming out with it. You've heard it in the news a lot right now. What I think is key to hear about it is that there's no rushing this. It needs to be available when it's safe and effective. And we're hoping that that's soon, maybe before the end of the year, but it'll be whenever it's safe and effective.
Okay. Perfect. And of course, we do have Cameron County Judge Eddie Trevino standing by as well. So Judge, what power do local officials have on residents compared to state? If the state, for example, does not enforce a particular procedure or a particular law, how can local officials enforce it?
Well, the local authorities, the county judges and the mayors do have quite a bit of extensive emergency authority. Obviously, this was a health and safety issue when it first arose, different than what we might normally, that we're used to. In other words, when we know that a hurricane's coming, we're kind of used to this. But this was a new area, but we still have extensive authority. And as Dr. Castillo mentioned, we were among the first counties in the entire state to issue shelter in place and other necessary mandates, even before the state got involved. Initially, the state allowed the local authorities to determine how far or how much they wanted to exercise that authority. And I think it served us well when the state began to reopen. And we think they opened just a bit too quickly, and people were already having some fatigue, and only 2 months into it. We saw the results of it in June and then July, when we became one of the hot spots in the entire country and world. Thank God we're doing better today. But as Dr. Castillo has said and Donald has mentioned, this virus is here for the long term. And if we don't do our part, it's going to do everything it can to take advantage. It doesn't care if you're healthy or not healthy. It's just looking for a host in order to continue to survive. So all of these changes that we've asked people to implement in their daily lives, the wearing of masks, social distancing, avoiding crowds, personal hygiene, washing your hands frequently, not touching your face, and staying home as much as possible. We know those are the tools in our toolbox that work. Everyone's talking about a vaccine. We hope that we get one, but we need to make sure that it's going to be valid and efficient and proper and properly vetted and tested. So until we know that that's the case, these are the tools that we have in place. It's worked elsewhere in the world, and we need to continue to follow it here. If we don't, and God forbid we have another spike, the law allows us the authority needed in order to re-implement the changes that we need to do. If shelter in place or curfews or whatever it is that we need to do, we'll do it. Right now, those orders are in place, but we're reviewing those, and we plan on making some changes here in the next day or so.
Absolutely. And you mentioned that the virus is here long term. So thinking forward, will the city have any announcements regarding upcoming holiday-oriented community events for the rest of this year? What are your thoughts on that?
Well, I can address Labor Day since that's this coming weekend. We saw what happened with Memorial Day and July 4th. We saw people basically get out, many of them without masks, many of them not socially distancing, many of them congregating and not taking care of themselves, both either at restaurants or bars or parties, at people's homes, and obviously at our beaches. That led us to make the very difficult decision to close our county beaches. We think that if the island of South Padre had followed our lead, we may not have had as many cases. I think we still would have had a lot of cases, but we may not have had as many cases because part of the problem was people, they've got cabin fever. They want to try to get back to normalcy, you know, and we all want that. But the reality is that we're not in a normal situation right now, and we have to continue to modify our behavior with COVID in mind. So this particular weekend, because our hospitals are in much better shape than they were a month or two ago, and our number of cases are falling, they're still not where they want to be. Dr. Castillo said in one of our press conferences a few weeks ago that the optimum scenario would be below 50 a day for a county our size. Well, we're still at double that, and but obviously that's a heck of a lot better than 200 and 300 and 500 daily, which we were experiencing there for quite a bit of time. So we plan on modifying our emergency orders over the weekend, and we'll have more announcements on that tomorrow. But we need to get past Labor Day, and then we'll be trying to lessen some of the rules that we've got in place right now. But everybody has to continue to follow the mandates and requirements and recommendations that we've had, because if they start relaxing, if they start thinking that things are okay, that we're past the worst part, it's going to come right back and we're going to have to start all over from scratch. It's something that we've been saying from day one. Better to stay at home for a couple of weeks and suffer as opposed to months. We didn't do it, the country didn't do it, and now look at the result. So everybody, we need to learn from our mistakes and what's worked here and what's worked elsewhere in the world. And Dr. Castillo will tell you, if we listen to him and his directions, which is we've been trying to do, we'll be in better shape.
Yes, and we do have a few more questions here, and then I want to hop on over to Donald. One viewer is asking, can we get COVID-19 from mosquitoes? I don't know if someone would like to answer that, perhaps Dr. Castillo?
I'll answer that one. No, you can't. The way we get most viruses from mosquitoes is not because the mosquito injects you with somebody else's blood. First of all, the SARS-CoV-2 that causes COVID-19 is not really in the blood, but the mosquitoes can't get infected with it, so they can't give it to you.
Okay, perfect. And Judge Trevino, you mentioned the beaches earlier. One viewer is asking, when will county beaches open? Maybe you can elaborate a little bit on your thoughts.
I will be addressing that tomorrow. Basically, we need to get past this weekend, and then I think we're going to be implementing a plan to address that. People will be not as angry with me as they are right now, but we need to get past this weekend, and hopefully everybody understands the importance of when we do reopen, that they've got to continue to follow the mandate, social distancing, wearing the mask. We know it's not necessarily comfortable on the beach, but if there's going to be people on there, everybody needs to do their part.
Excellent. And another viewer is asking, where exactly can we get tested in the Valley? I know this was mentioned earlier, but perhaps we can go ahead and talk a little bit about that and just reiterate those points.
We've got numerous testing locations. Obviously, there are pretty much many physicians and many clinics now have the capability to test. UTRGV continues to test, and we do have the Texas military assisting us. I'll get that the latest location for the next few days here in a minute, but I don't have that right in front of me, but I'll get that and provide that to you. But you should be able to call any of your local doctors and your physicians in the event that you feel you need to get tested.
Thank you so much. Now, Dr. Castillo, we have a viewer that's written in, and she is a mother and she has a son with a heart condition. So her question is, what advice do you have because her son also has asthma? Is there any advice you can give, any helpful tips, any information you could provide?
The advice is to really shelter away from this virus. Is to try to, like the judge said, try to stay home as much as you can. Families with school going to be restarting are having to make those kind of decisions. And so if people have high risk individuals in their household or in their bubble, think of your family like a bubble. So you interact with certain people on a daily basis. Anybody who enters that bubble is bringing in all of the risks that they take. Right? So if you have somebody in your bubble that's vulnerable, everybody needs to realize that whatever risk they take, it's as if the most vulnerable person were right there with them. So if you have a vulnerable household member, like a child with heart problems or asthma, or prone to any other major complications of COVID, there's been thankfully very, very few deaths in children. But we don't know the long-term complications of COVID. This is a new disease. There's some rare things that can happen with children, but obviously we don't want to test that out, right? And we don't want it to happen to our loved one. This is not the kind of virus you want to just say, it's no big deal, just go get it and get over with it. No, do not do that. Whatever you've heard in the media about that, or social media even, or misinformation, I would not want to test this out on my child. So basically it's about avoiding the virus. And right now it's kind of like a weather report. What's the weather out there? And so right now, unfortunately, there's a lot of COVID out there in our community. That's what we're trying to say by publishing these numbers, by showing the numbers online, so you get an idea of what's the risk. And right now the risk is high. The good news is it's coming down. Hopefully we get through this holiday, and if everybody does their part and we don't get a spike, then it'll be safe for kids like her son to be able to go out more and to be able to do things. But right now, because of how much is out there, they really have to be careful.
Thank you so much. We still have viewer questions coming in, but for now, let's go ahead and go to AARP RGV lead volunteer, Donald Ham, for some more questions. Donald.
Hi, everyone, and thank you for joining us again. For the latest information and resources about coronavirus, please visit aarp.org/coronavirus. Again, the website is aarp.org/coronavirus. Now, many of the questions have been asked, a list of questions that we had prepared, but I want to just reiterate a few. This is for the doctor, Dr. Castillo. Should everyone be tested for the virus, or should people get tested only when they think they have been exposed to someone with the virus, or they simply feel a little sick?
So, the first thing is to understand about how good is this test. If this test was so good that it would detect every single person with the coronavirus, it would be really simple. We would just test every single person, but it doesn't work that way. So it's obviously works best when you test people who have symptoms. And you can tell now that the COVID-19 symptoms are kind of tricky. So it could be a sore throat, it could be runny nose. So if I feel like if a person is worried that they have COVID-19, they're concerned they might have it, then they should get tested. At the beginning of all this in March, no way, good luck with that. There was not available, you had to send it off to the CDC. When the state had it, we basically could only have enough tests for people who were so sick, they were in the hospital on a breathing machine. Now, the tests can come back really quick. They're available from your doctor. The prices are coming down. Maybe by October, there'll even be a $5 test that you can get results in a few minutes. So once we have tests that are quick, inexpensive, and reliable, obviously it'll be easier to test even for minor symptoms, and eventually maybe even just to start routinely testing before you go to a family visit after you come back from a trip. So right now, what I feel is if a person's concerned that they might have COVID-19, they should get tested. Some of the guidance might have gotten confused when the CDC said, well, if you've been exposed, you don't need a test. I think the better way to would have put it is, if you've been told you have been exposed to a person with COVID-19, that you were in close contact with them, you need to quarantine. The testing doesn't get you out of quarantine, because you can be tested every day and be negative, 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 negative for 6 days. And then suddenly on day 7, you're positive, right? So if I just do one test and I did it just a little bit too early, I gave you a false sense of security. So if you've been exposed, we still need to do 14-day quarantines. But there's a lot of virus out there that you don't know you came into contact with somebody. So if you're concerned that, maybe you did a high-risk activity, maybe you did go to a get-together, maybe now you're thinking about it, you say, oh my goodness, maybe I shouldn't have done that, and you want to get tested, get tested.
I've got some follow-up with regards to that. Tomorrow, they'll be testing at the Marine Military Academy in Harlingen from 9 to 1 until the supplies last. Also at the Indian Lake Police Department, 62 South Aztec Cove. It says here Los Fresnos. That's here Los Fresnos. I'm sorry, but that's Indian Lake. Sorry, no, not Los Fresnos, Indian Lake. That's tomorrow. And then next week, Wednesday and Thursday at the San Benito Fairgrounds, 9 a.m. to 1 p.m. And Los Indios again next Thursday and Friday. That's the Texas military testing. That's free, no appointment is needed, and they'll give testing until they run out or until 1 p.m. But if you can't make those, you have the ability to contact the clinics or the doctors. There is more testing available to us today than there was several months ago.
Thank you so much, Judge, and thank you, Dr. Castillo. But just to follow up, just so the public is clear, I know that flu season is starting. Actually, September starts flu season. So many of the symptoms can be masked by flu. So just to be clear, what are the corona symptoms people should look for on a daily basis?
Again, the symptoms are really similar. It's going to be hard to tell the difference between the flu and COVID-19 unless you test. And by the way, it's possible to get both at the same time. You can absolutely have flu and COVID at the same time and get tested positive for both. So the good news on that is what you do to avoid COVID is the same as what you do to avoid flu. Those physical distancing, wearing masks, washing your hands, not touching your face, avoiding the crowds, staying away from other people basically is how you're going to protect yourself from both of those things. The difference is there's an influenza vaccine out, right? And it's available now. A lot of pharmacies are having it. Doctors' offices are getting it in stock. And for older people, there's a special vaccine that's more potent for the influenza that'll give extra protection because if you're older, the immune system doesn't respond as vigorously to a vaccine. So there's a special version for people who need a stronger boost to their immune system out there. And if you've had the flu vaccine, that'll reduce your risks of getting the flu. It'll reduce your risk of getting seriously ill from the flu. And that's something you could do now that's different than COVID. So basically, you don't want to have to tell the difference. If you do get sick, you want to be able to say, I had the flu vaccine. And you're still going to get tested for the flu, and you're still going to get tested for COVID if you have symptoms.
Thank you. Thank you. This question is for either Judge Trevino or Dr. Castillo. What is the latest news regarding the number of coronavirus cases in the Rio Grande Valley?
I've got that, Doc, if you want me to address
Please.
that.
Yeah.
Okay, for Cameron County, we've got approximately 118,000 individuals who've been tested. We're up to 21,342 positive cases, 96,700 confirmed and unconfirmed negatives, and approximately 16,000 have cleared or recovered. I'm very sad to say that we're up to 621 deaths, and we anticipate that continuing to climb as we continue to receive confirmations from the state. The state has us at a much larger number. Dr. Castillo can address that, but we're at 621. That's 621 too many, and unfortunately, we're anticipating more.
Thank you, Judge.
Yeah, about the difference in the death counts. The state recently started using their access to the death certificates to report out COVID-19 associated deaths. On the county side, when it comes to these reportable diseases, we're obligated on the county level to do an investigation, not just take the death certificate at face value, which we don't even have access to. So we have a case and we look into it, we review the medical records, and when the county is saying this person died of COVID-19, it's based on a review of all those records. I believe over time, the death certificate data and our data, our numbers are going to look very similar.
Thank you, Doctor. Again, for the latest information and resources about coronavirus, please visit aarp.org/coronavirus. Again, the website is aarp.org/coronavirus. I only have one more question in this segment, and I think most of the questions have been answered. But this question deals with testing as well. Many people are, especially the elderly, are concerned about how expensive the tests are. Can anyone shed any light on the cost for getting a coronavirus test?
From when there's one of the sites from the Texas military, those are open to the public. They're funded by the government. There's no cost associated with it. If you go to your doctor, those tests are usually covered by your insurance, right? If it's being done for symptoms, is covered by insurance. There's at-home testing. There's in-office testing. A lot of the PCR-based testing. So this is the swabs that look for the virus genetic material. Those are around $125, give or take. The antigen testing, which is looking for the outside coding, the protein coding of the virus, are less expensive and the results are coming back quicker, but maybe they're not as sensitive. In other words, they might miss some cases, some false negatives. It said you're negative, but you might actually have the disease. Their advantages, they're cheaper and quicker. And the tests that are coming out soon, there was one approved by the FDA. It doesn't even require special equipment. It's a card. It'll be available in physicians' offices, hospitals, that the cost is going to be down to $5. So I think a tremendous number of innovations have been made in testing. Just from March till now, it's incredible. So it's getting cheaper, it's getting quicker, and it's getting more reliable.
The city of Brownsville is also continuing their drive-through testing. I forgot to mention that. You can go to their website in order to try to sign up, and they've got several sites available.
And that's also based on a program that covers the cost.
Thank you so much, Judge, and thank you, Doctor. I will now refer back to Danielle.
Yes, let's go ahead and continue taking comments from Facebook and our viewer section. So we do have one viewer that is asking about a curfew, specifically a day curfew. So I don't know if someone would like to talk a little bit about that.
I can address that. The question is there a day curfew?
Yes, they're asking if we're going to have another curfew, if there's going to be one during the day, during the nighttime. What information can you share with us?
Okay, well, right now we do have one in place. It starts at 10 in the evening for kids that are 17 or younger, and 11 and later for adults. We're looking to revise that based upon the numbers that we've seen to try to extend that a little bit longer, or and again, we want to get past the Labor Day, so we're talking 2 weeks after that, but we're looking to extend that. There's no consideration for any type of a day curfew, but it goes back to what we've talked about before, which is if there's no reason for you to be going out, in other words, you're going to H-E-B or Walmart for your groceries, fine, or you're picking up food at a restaurant, fine, and you're going to work. But other than that, if you don't need to be out and about, don't be out and about. You want to exercise, exercise. There should be plenty of room in somebody's neighborhood or at some of the walking trails. But we need everybody to continue to modify their daily behavior. And the more everybody keeps following it, the orders and the recommendations, the better off we're going to be. Let me thank everybody in the Valley that has been following our orders and recommendations. Things would have been much, much worse if people weren't doing that. And if people weren't wearing their masks and following the social distancing and doing everything we've asked, the numbers would have been even worse. And we would not have been able to come down as we have over the last 30 to 45 days. But as we said before, and we'll continue to reiterate, we are not out of the woods. This is going to be with us for the long haul. So we've got to modify our behavior. And if we do that, we'll try to go back to some sense of normalcy as best we can. But we're all in this together. So everybody's got to do their part, not just for themselves, but for their family and for their neighbors.
Thank you so much. And going back to the topic of testing, Dr. Castillo, we have one viewer right now who is asking if there are any other ways of getting tested other than the long Q-tip.
Yeah, the long Q-tip. So that long Q-tip you're talking about is the one that goes all the way to the back of the nose, hits the back of the throat, called the nasopharynx. That is a very unpleasant test. There's some of the new tests out that use a Q-tip that only goes in about 1 inch into the nose, and it takes the sample from there instead of going all the way to the back. You can pull samples from other places. The reason why they like to go all the way back there is that's where most of the virus is. So if you want the best chances of seeing it, unfortunately, you got to go all the way back there. Some of the new tests are based in the middle of the nose. I've had that one done. It's not fun either, but it's not as bad as the other one. And then there's a new saliva test that's probably coming out. So it'll be as simple as spitting in a vial with no Q-tips at all. So right now, most of the tests though are swab based. A lot of them still involve going into the nose, because if you're going to do it, you really want to have the best chances of finding it. You don't want to take a half, not a good sample, and you got a false sense of security. You were told it's negative, but it's actually not.
Yeah. And speaking of false sense of security, some tests take 3 days to get the results back. Some take 20 minutes. What are your thoughts on comparing those two types?
For the test to be useful, you really want those results back in a day or two. Unfortunately, we last week were reporting numbers from tests that were in July. So that's not very helpful to us in public health to be able to go and say, well, who were you in touch with? Who else do we need to warn? Who else can we tell they're exposed? Who else do we need to quarantine? So the ideal test would come back right away. So the new antigen testing tends to come back within minutes. There's some PCR tests out there that come back within 10 minutes. A lot of what you see these days, though, now that the labs are with better capacity, is usually taking 1 to 2 days. For the PCR, on the big machine, the best test out there, the most sensitive test out there, is taking about a day or two for results to come back.
Okay, very good to know. Dr. Castillo, we also have a viewer asking if the virus has mutated.
The virus always mutates. The question is, has it mutated enough to be different? And the answer there is no. It hasn't had to. It's being able to spread just fine the way it is. So these viruses tend to only mutate when they have to get around something. And a mutation can be for the worse or for the better. Sometimes viruses mutate to become less bad, less severe, less deadly, because that would actually help them spread more if it doesn't hurt their host. So what they found on this virus, all those mutations you've heard about are really minor, and they don't seem to have had a change in severity. There might be a mutation that happened that changes how contagious it is. And you can see from the virus's point of view, the more it can spread, the better. So that might have happened. There's a lot of debate about that. But in terms of, has it mutated to be a more dangerous version or less dangerous version? No.
Very interesting. And, you know, we live here in the Rio Grande Valley by the border, of course. So one viewer is asking, if they go to Mexico, should they indeed self-quarantine?
You want to answer that? Yeah. The scenario, first of all, Mexico has implemented protections and restrictions with regards to allowing American citizens to travel into Mexico. If you don't have not an emergency, but a necessary reason for being over there, they're sending people back. That's number one. Number two, on our side of the border, the administration has restricted access with regards to Mexican nationals coming over. So it's impacted our bridge traffic and commercial traffic and revenue in a very negative form. One of the, I don't know if they've been asked this, but one of the questions has been, have we gotten a lot of impact from people crossing, and that's how we've gotten COVID? That is absolutely, there's no truth to that whatsoever, because we were impacted actually before Mexico got it. So Mexico was actually taking precautions against Americans going over. And for those of us who live here on the border, we know that we cross on a daily basis. Many people live in Brownsville, work in Matamoros. Many people live in Matamoros or Reynosa and work in Brownsville and McAllen. So, but basically, we're all part of the same neighborhood. We're all part of the same area. The closing of the bridges would have had zero impact on the spread of COVID on both sides of the border. So I think both countries have tried their best to do what they can. But it's, I think Mexico is probably in a tougher situation because they don't even have the resources that we do. And yet, Dr. Castillo just alluded to it. We were sometimes waiting anywhere from six days to 2 weeks to get a result. Individuals were, and that is of absolutely no use to anybody, including the individual. And that's why contact tracing kind of went by the wayside, because we weren't getting the test results back in time, and the virus exploded so that we just couldn't keep up. It was a bad combination.
And we know that the virus has, of course, been very disruptive to people, specifically in regards to the workforce. So we have another viewer asking, at what point can an employee return to work after they're tested positive?
So the person needs to home isolate, which means they need to protect their family from them too, right? Unless the entire family has been proven to be infected, you don't want to infect the people you live with. And there's things people can do from that. It's called home isolation. So that person needs to stay home isolation. They could work from home, but they need to stay home isolation. At the beginning, there was the CDC was recommending 2 negative tests to be able to declare recovered. Then they found out people can test positive for 6 weeks, and they're not contagious at that point anyways. So now the CDC, based on real world experience, in other words, let's see how long people can be contagious for, based on viral cultures, which are very difficult to do, has changed their guidance. They no longer recommend testing to clear, right? Because we recognize that a positive test does not mean you're infectious. It's going to be 10 days for most people, a minimum of 10 days from the day they became symptomatic or that they tested positive. If they had no symptoms, a minimum of 10 days. And then at the end of that 10 days that they haven't had fever anymore and that their symptoms are significantly improved. So if they were coughing, that they're hardly coughing anymore. If they had muscle ache, sore throat, diarrhea, that's all gone. So at the end of that, they're considered not contagious anymore, and they could return to work from a contagious standpoint. But now we're seeing, unfortunately, some people who, even though they're not contagious, they don't feel back to normal. There might be heart problems caused by this virus. There might be lung problems caused by this virus. There's people who are not bouncing back. So they're not contagious anymore, but they may not be able to go right back to work because they don't feel good yet. And then there's people who get put in the hospital. If you're sick enough to get put on oxygen or put in the hospital, you could be contagious for up to 20 days. And so for those people who got hospitalized, they're definitely probably not feeling up to going back to work, but they're going to be considered contagious for up to around 20 days.
Okay, and then to stay on the topic of the CDC, we do have a viewer asking, specifically Dr. Castillo, what is your opinion on the CDC asking the states to get ready for the vaccines?
Yeah, that's a great plan. We're talking about trying to vaccinate over 300 million people. Right, and we're not going to have enough vaccine for everybody at the beginning. And there's a lot of talk about, well, who's going to get it first, and who, which group should get it. But there's no doubt, if you look at it just from a logistics standpoint, how do you ship out that much stuff? How do you get it to the places where it needs to be? You better start preparing now. A lot of these companies have even started already producing the vaccine before it's even approved, because they don't want to waste time ramping up production. We don't want to waste time figuring out how do you distribute this. So I'm really glad that they're starting to talk about that now. There's no reason why not.
Very good. And I'm going to toss over to Donald in just a minute, but just to reiterate for those just joining in on the Facebook Live, for the latest information and of course resources regarding the coronavirus, you can visit aarp.org//coronavirus. Again, that is aarp.org/coronavirus. This, of course, has been a very informative discussion. And our thanks go out to Cameron County Judge Eddie Trevino and, of course, Dr. James Castillo for answering all of these questions and our viewers' questions, as well as for your hard work and dedication to our community. So thank you again for being here. And thank you, of course, to all the staff at Cameron County and Cameron County Public Health, and of course to our viewers for participating. So Donald, I'm gonna go ahead and ask one final question here on behalf of a viewer, and then I'm gonna toss it over to you. So one final question: what will happen once schools go back to face children going back, and do you think that the virus will increase? What do we think is going to happen in regards to back to school?
I'll let Dr. Castillo answer the first part, and then I'll finish up.
Okay.
So what we've seen in other states who have tried going back to face-to-face is that you start getting cases in teachers and students if you reopen too soon. Just like we learned the lesson over, these past months, if you reopen too soon, when the virus is still around, there's consequences to that. Schools, though, are special. I mean, schools serve a vital function, right? So if we're going to have to take a risk, where do you take it? And that's where you come to schools. There's definite benefit. So if we can wait until the risk is low enough that the schools can put a plan in place to reduce the chances of it spreading in the school, right? And they stick to those plans, then it becomes reasonable. Right now, we're starting to see that trend develop, that we hope that we can go back to that face-to-face learning for the kids who in their families and with their parents have decided that that's right for them to take that risk, and that the schools are doing a great job. All the schools, the public schools, the private schools, are all doing a great job of trying to protect their staff and their students. And so I think everybody wants to do that. So what can we expect? Well, if we wait until the rate of the community transmission is down and everybody follows all the recommendations that are out there, especially around masks and the distancing and the hand washing and all those things we keep talking about, you apply that to schools with a little twist in terms of making sure you don't have huge crowds. You're not doing, those kind of big events, that the classroom sizes are small, right? And that if you do get a case, that we're in a position as a county to trace it down and quarantine and prevent a big outbreak. Because if you open schools, you want to keep them open. You don't want to open schools just for them to shut down after there's a big outbreak of a bunch of cases. So that's what I think we need to do. We need to wait for those cases to be down. And the good news is we're in that direction. And if everybody does good over Labor Day, if everybody keeps doing everything they've been doing and making those sacrifices, we're doing it for the kids so they can go back to school.
We've been working with the superintendents now for several months. Well, pretty much it's all of this began, how to finish out the spring semester and then how to plan for the fall semester. In July, when we started having our very serious uptick and surge in cases, there was a lot of concern as to what was going to happen when schools were looking to reopen in August. And after speaking with the superintendents and the school board members, we realized that the safest route to take would be to institute and order virtual or distance learning and not have face-to-face. Dr. Castillo and I have talked about this for a long time, spent many hours on it, dealing with the best way to address it. And that's why we issued the order that we did. It's caused us some issues with individual schools, especially private and or religious ones, but we're working our way through that. Everybody's been fairly cooperative, understanding our viewpoint, and we're trying to take into account the unique circumstances of each particular school, especially the smaller ones. So we're working with them. Our concern is that a child, our concern with the children of the county whether they went to public school or private school, we wanted to make sure that we were afforded that protection. And also going forward, even when they do begin implementing back face-to-face learning, that parents are given the option of continuing to have distance learning as part of the education process. We think that'll probably lead to the best success possible, so that we don't congregate more than is absolutely necessary, and we build our way back up to face-to-face, whether it's 100% or any percentage below that. So, but we're going to need all the parents and teachers, administrators, custodian staff, educators, everybody working together to make sure that our children and our school personnel, just like with our first responders and our doctors and our nurses in the hospital, are all protected, because we're all in this together.
Thank you so much. Donald, I think you have a few viewers with questions as well.
Yes. You know, with the senior Americans, there are mostly three issues that they're very concerned about. Of course, it's health issues, caregiving issues, and also provider issues, whether it's nursing home or being provided for at home. So Dr. Castillo, what are the most important things that someone should be sure to have in their homes to stay protected from the virus?
It's that concept of the bubble, right? And how many people you let into your bubble, and what kind of risk are they bringing into that bubble? And unfortunately, one trend here in the Valley that I definitely saw was that healthcare providers in the home were bringing it into that bubble. Just like we saw healthcare providers bringing it into the nursing homes. It's one of these things where when you mix those bubbles together, you bring the risk. But it's a risk that you're forced to take. It's a risk that you're forced to take because you also need that care. So again, the mask wearing, right? Especially if you're around anybody from outside of your bubble, right? Wearing masks, even in the home setting, is totally reasonable, okay? Washing the hands and trying to keep that time down to a minimum, and the distance, even inside of the household, if you have that choice. Again, it depends on how much care a person needs. But it's one of those reasons why this virus is just so insidious. It follows those vulnerabilities and all that human interaction that you need. So this is why we can't stop that kind of caregiving from being necessary. So that's not optional. So we have to look at what are the optional things that we can curtail so that we can allow that caregiving to keep going on, right? And that's where we're into, you know, having to restrict big gatherings and concerts and sporting events and indoor bars, things like that, so we can reduce the risk of this virus sneaking in through those into those vulnerable areas.
Thank you, Doctor. You know, along with the coronavirus, not only health issues are concerning, but also our mental health as well. And I think many of us in the healthcare community are feeling a little, difficulty as well. But what should someone do if a loved one is feeling anxious due to fear? And what are ways to keep them calm?
I guess it's also to put it into perspective and focusing on what you can do to stay safe. So, we know that if you follow all those recommendations, that the risks of acquiring this virus are pretty low. For those who are younger, or have, to also put it into perspective, this virus is not a death sentence either. The vast majority of people will survive and get through this. The percentage of people who are dying from the virus is sizable, but and I'm not trying to minimize it at all. But again, putting into perspective, the vast majority of people who do get this virus are going to get through it, even if you're older. So trying to, again, put it into perspective, realize the control that you have, and then reach out for help if you're feeling that you're having these issues. There's a COVID-19 mental health support line, and that's at 833-986-1919. So 833-986-1919, or you can even just look up mental health support COVID-19 Texas, and get access to that type of counseling.
Thank you, Doctor. Judge Trevino, I know that this coronavirus has taken a toll on our local economy as well. Many people are out of jobs and are struggling to put food on the table. So what local resources should people explore to help a loved one with the purchase and delivery of food and supplies?
Well, I know we're running out of time, so I'm going to try to give as brief an answer as I can. And it's an indirect answer. Cameron County, because our population is below 500,000, got $55 per capita for county residents, meaning those people that did not live in the cities. So we got a total of 5.5 million. Hidalgo County, because it's got a population of over 500,000, got over $150 million. That difference in allocation based solely on population, the state gave us $55 per person, and that got us to the 5.5 million. Hidalgo had the 151 million. If we had gotten those resources based upon just the number of people that live in the county, we should have received approximately $75 to $80 million. If we had received that amount of money, we would have been able to provide a lot more help from an economic standpoint to those people who needed help with their rent payment, with their house payment, with the utility payment, and or food. So it's been a very, very tough situation from us not having the resources available to help those people in need. We've done everything we can. We do have a few programs with the Cameron and Willacy program assisting up to about 125 families with utility or rent assistance. And thank goodness and thank God our nonprofits and our churches have been instrumental in providing food to those in need. I've been involved in several food drives and giveaways these last several weeks. But so the reason I started with that, and I'll end with it, is that if you've not registered for the census, you need to register for the census, because every person needs to get counted in Cameron County and throughout the state of Texas. If you don't, we lose out on resources. So by the 2010 census, which we all know in Cameron County, we have more than 500,000 people. Had we gotten that done the right way, just in this one instance with CARE funding, we would have received another $75 million. That's just one example. It goes to education, housing, infrastructure, first responders, law enforcement. All of that money is census-based. So we need everybody's help to please make sure that they register for the census. The deadline right now is September the 30th, and we need everybody to participate.
Thank you so much. I know, Donald, you have a few final thoughts because we are indeed running out of time, and then I'll go ahead and wrap up.
I just want to thank Judge Trevino and Dr. Castillo for participating in today's event. If there are any unanswered questions, they can go to aarp.org/coronavirus or /RGB to answer some of the questions. Again, thank you so much that we're able to hear from our community experts in reference to this coronavirus. We've never experienced anything like this before that I can remember, not in my lifetime. So I am very pleased to be among such dedicated public officials. I just think that each and every one of us should do our part to help in this pandemic. Thank you.
Of course, thank you so much. One more time, we're going to give everyone the information. If you'd like the latest details and resources about coronavirus, you can visit aarp.org/coronavirus. One more time, that web address is aarp.org/coronavirus. And with us today was Donald Ham, AARP RGV, Cameron County Judge Eddie Trevino, and of course, Dr. James Castillo of Cameron County Health Authority. This has been a very, very informative discussion. We appreciate everyone being here. And thank you as well to all of the staff at Cameron County and Cameron County Public Health. And of course, to our listeners and viewers online participating in this discussion. Thank you, everyone, so much for being here. We appreciate your time.
Thank you to everyone for doing your part. We appreciate your help so far, and please continue to work hard to keep the virus at bay.
Thank you. Thank you. In the face of this crisis, AARP is providing information and resources to help older Americans and those caring for them to protect themselves from the virus and preventing the spread to others. All of the resources referenced in today's Facebook Live can be found at aarp.org/RGB. Again, that website is aarp.org/RGB. I want to thank each and every one of you for your participation, and we hope you learned something new about coronavirus and keeping you and your loved ones healthy. Thank you again, and have a great day.
God bless you guys.
God bless you too.